I can think of many reasons why cardiologists would be sort of ideally suited for a role in sort of industry or technology specifically. First and foremost, just being the fact that if you look at innovation over the years, cardiovascular medicine, probably above and beyond any other specialty of medicine, has probably had the most technological innovation. And that spans all the way from new devices to new diagnostics to clinical trials and how do you actually validate or prove the efficacy of new technologies. So I think physicians and cardiologists are sort of used to that gamut of the entire spectrum. But otherwise, the other big sort of factor there is also heart disease, happens to be the #1 killer, not just in the US, but globally. So it's also something that many people are just familiar with. They're aware of heart disease and the sort of toll it takes on people's lives. And lastly, it's around the fact that cardiologists are very well versed in physiology of medicine, right? If you look at just the common vital parameters we look at to understand if a person's, are they ill or not ill, we look at heart rate, blood pressure, all these parameters that really are the core heart physiology. So if you combine all those things together, I think that makes sort of ideally suited for it. And the last thing is also the person themselves, right? So there's this level of risk tolerance, and cardiologists for some reason happen to be sort of folks that are willing to take a risk and try new things, and we're just ingrained in that culture.